Network for Adolescents and Youth for Africa (NAYA) is calling for legislation that safeguards youth and adolescent rights and protects them from teenage pregnancies, drug and substance abuse, and gender-based violence. Speaking after Adolescent and Youth Sexual and Reproductive Health and Rights Consultative Forum, NAYA Director Victor Rusugu noted that it is time health systems are structured to cater for the needs of adolescents and youth who have early pregnancies, addicted to drugs, or are victims of gender-based violence.
Whatever recommendations that the teams are going to make, we are going to have them discussed by our members. And if there is need to pass laws, there is need to pass bills, then we are giving our commitment to the experts that we really are on the forefront. And the goodwill is there, as you can see by the number of members who have attended this forum here today. So we'll make the laws. And when we make the recommendations for implementation by the county executive, then further, in the next 5 years, we're going to hold them accountable on matters of youth.
Our discussion today was looking at how can we be able to address the challenges facing young people, especially sexual and reproductive health challenges and other issues around teenage pregnancy, gender-based violence, mental health, drug and substance abuse, and this means that there is need for correct and consistent information to young people around these issues. Then our healthcare system must also be structured to respond to the needs of these young people. There is also need for parental and peer support to young people to be able to make the right decisions around their sexuality.
Basically, the issues of the network of youth on issues to do with adolescents is an issue that the committee also looks into. In the last assembly, we had an engagement with them. They also played a big role in advocating for some of the policy and also legislative agenda. The Nairobi City County gender sexual-based violence came also as a result of this close engagement. And basically, we are looking at youth in a context of a devolved system where we can say youth is not a devolved function, but all devolved functions have adverse effect to youth.